if you deflect the debris, we don't know where it goes. It can go to the intestine, it can go to the renal, it can go to the peripherals. So a better idea is try to capture as much of debris as possible and then remove it from the body. I think that's the main aim of protected TAFI.
I think having that visual confirmation creates a sense of satisfaction for me and knowledge that I'm doing right by the patient.
Well, if we deflect debris, then we're putting it somewhere else. And we know that the brain is the most important place where we want to avoid embolization, but it's not the only place. Patients from TAVR have a risk of acute kidney injury following the procedure. Some of that may relate to embolization of debris. There's a very small but significant instance of gut embolization which can have catastrophic indications. So if we can get rid of that debris, that's what we want to do, not just put it somewhere else other than the brain.
The concept of deflecting debris implies that you are always deflecting it into a safe place, which is not always known. I think the idea of being able to capture it and remove it safely appears to be a much safer alternative, though trial data will have to prove that.
It's important to remove the debris from the circulation rather than deflect it, because if you deflect it, it can injure other parts and other organs downstream the heart.
This is an important issue because if you can capture it, it's out of the patient's body and it can't embolize. And in addition, from a scientific standpoint, we can analyze what we captured.
It's a very important question because the point is not only to avoid emboli within the brain. A patient is a whole entity. There is not only the brain, we have the digestive area, we have the lower limbs, any kind of organs that can be affected by these debris. So, to my opinion, it's really important to capture the debris rather than only deflect them. And so that makes the interest of the Sentinel device, because it really captures maybe 90 and protects 90% of the cerebral territories, and this is, to my opinion, quite important for the patient.